Infectious disease specialist Dr. Zain Chagla joins us via Skype this morning to answer more questions about the latest developments of COVID-19. Happy Friday.
Happy Friday, yeah.
I want to start out with a viewer question here. The Pfizer vaccine, which is getting rolled out in Ontario next week, it has to be stored at minus 75 degrees Celsius, as we know. How does that feel going into the arm?
So thankfully, we're not injecting it in minus 70. Otherwise, that would be a painful surprise to many people.
Yep.
The vaccine does get thawed out to regular temperature and then is injected then. Of course, we can't inject substances that are minus 70 into people. That would be fatal. So, it's a normal temperature. It's just the storage is minus 70.
Yeah, okay. The UK is doing something interesting. They're mixing and matching doses. In January, they're trying the Pfizer dose first, followed by the AstraZeneca Oxford vaccine, thinking that might be more effective.
Yeah, I mean, there's examples of this in other vaccines. So, the way we do our pneumonia vaccine, for example, in high-risk individuals, you take one vaccine from one company and then you follow it with another vaccine from another company. And the thought is that both work better than them individually. As we have one vaccine that works really well, the Pfizer vaccine and Moderna soon, it's interesting because they're going to be the ones that are going to be on top of the market, but we don't actually quite know if they're the optimal vaccine strategy. So these UK researchers are saying, hey, for some people, we'll give them one dose because it'll still work, but let's see what the other vaccine does to them too, in case that's the better vaccine strategy.
Now, in the UK, we have seen some adverse reactions and also some allergy warnings too. What's the level of concern here?
Yeah, I mean, it is something. This is a vaccine that's obviously being watched more than any other vaccine in the world. There are a couple of cases. They were in people that had pre-existing allergies. It sounds like more pre-existing drug and vaccine allergies rather than actual medication allergies. Remember, everywhere that we give a vaccine is equipped to handle allergic reactions. It's the one thing they're equipped to handle. So, it is something we have to watch for as we probably get the vaccine rolled out more and more. We'll figure out what component exactly it is. And even in those individuals, we have protocols and tests to actually go through for some people to make sure that they're able to tolerate it and do it in a safe manner. So it's something to watch for, but it's not necessarily a barrier for most people to get vaccinated.
Okay. What did you see that concerned you in the modeling yesterday? We're seeing the positivity rates flattening, but we're still at a critical spot, particularly with the reproduction numbers.
Yeah, unfortunately, there's just such a big community burden and numbers are growing across the board, particularly in the Golden Horseshoe. And, there's only so much the system can handle of this, right? As the more cases we have, the more that gets into long-term care, the more that gets into our hospitals, the more healthcare system is so strained. And so, we're on a path where we're not necessarily going through that explosive growth we're seeing in Alberta, but it's still a path where there's a significant burden that's pushing down many of our vulnerable populations. So it's we're nowhere near out of the water yet.
Yeah, we've talked about the vaccine resistance before. What's needed percentage-wise in Ontario for so-called herd immunity?
Yeah, if this vaccine really truly does prevent people from getting infected, which we're not clear yet, or just minimizes their symptoms, we have to say around 70, 80%. Does that mean that, we won't see long-term care outbreaks if we get 70% of the population vaccinated? Actually, you probably just need the long-term care facilities immunized and their workers to prevent outbreaks in those communities. So a very small percentage in that sense. But to really kind of put a dampen on community spread, take into account people's variable immune responses to the vaccine, the modeling suggests about 70% of the population needs to roll up their sleeve.
Yeah. Now, from rolling up sleeves to the actual rollout, and as I mentioned, so the first spots will be at Toronto and Ottawa at hospitals. But when rolling this out, and it's an ethical question, but what's more important, targeting people or regions with this rollout?
Look, the very ideal would be targeting the hotspots. And I think, you have a higher burden there. There's a higher risk of every individual getting infected any given day. And so the more vulnerable people, the more healthcare workers in those hotspots probably means more protection in general. At the end of the day, this is a difficult vaccine. It has its logistical challenges. It's our first time rolling it out. And the government has basically taken the stance, let's just get it to the hubs and go near the hubs and vaccinate people near the hubs. And just start there. You can still hit vulnerable people there. And to be fair, you know what? We just need to start getting vaccines into people rather than making it a perfect solution. It just needs to be a now solution. We're going to have the Moderna vaccine hopefully soon. That'll give us some expansion into where we can actually take these vaccines. But, I think at the end of the day, we just need to start rolling up sleeves in vulnerable people and start now rather than picking the perfect scenario.
Yeah, and this whole process is going to take about a year, from what we're hearing. Do you think immunity passports are a good idea?
There is going to be probably some tie to these vaccines if they do work, entering into certain facets of society. So being able to visit long-term care facilities, being able to travel. There's a precedent with the yellow fever vaccine where people carry around their card when they enter certain countries. So yes, I think it is. I mean, there's ethical challenges too. You have to really start discriminating at people, or if you're going to wait for those passports, you have to have everyone have a fair shot to get the vaccine first before you start saying and requiring things. But I do think you're probably going to have some tracking mechanism that's going to be linked back to your ability to go to vulnerable places. And that's just the reality of the situation, given how bad this can be.
Okay, great talking to you, and thanks again always for your expert input. Dr. Zain Chagla, have a great weekend.